Hey everyone, welcome back to my channel. I have a video today that's a frequently asked question, not just from my clients, but from those of you here on YouTube and Instagram. And I thought, you know what, now's the perfect time to make a video on this, hoping to give a little bit of insight into this topic. And that is, should you be on antibiotics for skin conditions, whether it's acne or eczema or psoriasis or any other skin conditions out there? So I'm going to share with you my thoughts and opinions as a nutritionist and homeopath. This is not meant to be medical advice, so always check with your doctor before making any decisions about this. This is just from what I've seen with my clients and those who've kind of gone through it, including myself, who've gone through the antibiotic route for skin conditions. I'm going to share with you kind of what I've seen and give you some good alternatives as well. So there are times where antibiotics are absolutely needed. Different staph infections, things like that. Absolutely, there are times where we are so thankful to have antibiotics. So I don't want anyone to think that they are horrible and should be completely dismissed. Again, there's always a time and a place. I do find that they are overprescribed way more than they should be, in particular for skin conditions. So I know personally, I had major issues with eczema my entire childhood. And every time I would go to a dermatologist or a walk-in clinic or my family doctor, they would say, you should be on antibiotics, you should be on doxycycline or some kind of Accutane or literally something like that, where it's a high dose antibiotic to help clear my skin, but really, really damaging. And I did it. I went on so many courses of antibiotics, and each time made my skin flare up. It would clear my skin initially, and then within a month, it would flare up 10 times worse. With that, I would also be getting recurring yeast infections, which I then never used to have an issue with. I would get recurring UTIs and so many other issues, including IBS, extreme IBS. So a lot of issues really developed after doing chronic antibiotic usage. So I have seen this to be the case with a lot of my clients as well. I find that doctors are very quick to give a Band-Aid solution that does have long-term side effects for a condition that can be quote unquote treated pretty effectively or very effectively from within using natural remedies. What is happening when we have skin issues? I've made so many videos on this, so I don't want to take this video up all the time in this video to go through that. But typically there is a massive component of dysbiosis. Sorry, I'm losing my voice, but there is a lot of pathogens in the gut, be it parasites, viruses, yeast, fungus, doesn't matter. There's a lot of pathogens in the gut for the most part for those of us with skin conditions. And as they begin to overgrow, they create a lot of toxicity and inflammation, which does impact our skin, creates acne or cystic acne or eczema and things like that. So the component of pathogens are there, yes, but I do not believe antibiotics are the solution, or at least aren't always the solution. When we have a skin condition and we have a lot of pathogens, we do want to clear them. That is the number one goal, to improve the skin condition. And it's what I do with all my clients, and it works every time. It works like a dream. Obviously, it takes longer for some than others, especially if biofilms are present and things like that. That's, again, for a whole other video, which I've actually made before. But strictly speaking, with pathogens, yes, you want to clear it. Antibiotics, though, and my issue with them being overprescribed is a couple things. The first thing is, they don't always kill what the problem is. A lot of times they will kill the bacteria or something else, but the yeast is still there. The opportunistic biofilm-based pathogens are still present and still thriving post-antibiotic treatment. So you take an antibiotic, it wipes out a lot of what's in the gut, so you feel better, your skin gets better most of the time. But then after a little bit, whatever bad stuff is left, it overgrows quickly again, new colonies form, and your skin flares 10 times more because now the antibiotics have killed off a lot of the good probiotics that you did have in the gut, which were keeping some of the bad guys in check. Now that those good probiotics are gone, the bad guys can overgrow much quicker and much more rapidly, eliciting a much stronger inflammatory reaction. So it affects the gut. It creates a major imbalance in the gut. The second issue that I have, actually, before I get to the second issue, I know a lot of people are going to say, well, then if you take antibiotics, just take probiotics and build up the gut again. But what people don't realize is it actually takes years to reestablish a good, healthy gut population. And it takes years of being really low stress, of doing everything possible for the gut, continuously supplementing with high dose probiotics. And a lot of times you cannot get back those strains that you were given in childhood during the birthing process and through breast milk or things like that. We build up a lot of strains in childhood that once they're gone permanently. And antibiotics can wipe them out. So that's my issue, is it takes actually a long time to rebuild up a gut population. So it's not always as simple as just taking probiotics post-antibiotic treatment and fixing it. My second issue with antibiotics is most of them really impact and negatively affect the liver, especially if you're taking an antibiotic treatment or course that goes on more than 7 days, that goes on for weeks or months. It is a lot of pressure and strain on the liver, and a lot of times if you read the side effects, it will confirm that. And that then burdens the liver more, which, as we know, if you guys have been following me long enough on here, liver strain means skin conditions. Toxins cannot be pushed out through the liver quickly enough due to an overwhelmed liver, and so they're pushed out through the skin, a different emunctory. And your skin will flare up again. And it's that much harder to repair and fix this liver, this inflammatory reaction that's occurred post-antibiotic treatment. So that's another issue, is okay, now there's not just gut imbalance within the pathogens and probiotics, there's now liver issues. The third issue is it actually triggers a lot of gut inflammation in general. Antibiotics are pretty harsh, and so that gut lining gets damaged, and now you have to repair the gut lining as well, which can take a lot of time. And this is also why a lot of people develop things like IBS and stuff post-antibiotic treatment. Another concern is that antibiotics do have quite a bit of side effects, and a lot of times you can have a really bad reaction to them, which can sometimes be life-threatening. That's not as common, but more importantly, for the more common things, you can have a flare-up in the skin, or it can push your autoimmune condition more intensely. It can create more of an imbalance within the immune system. And the list goes on. So there are a lot of concerns with people using antibiotics, and it's still not getting to the root of the problem. So I do believe that, in my opinion, working as a practitioner, where I specialize in skin conditions, there's a lot more effective options for clearing the skin. The thing is, we are living in a society that is so used to quick results. We want quick gratification. We want the results quick. If we don't get the results within a week or a month or a couple months or maybe even a year, we say it's not working and we want to move on to something new. And this is actually not our fault. This is because of our medical system. Now, I love medicine, like allopathic medicine. I think it is incredible and it is absolutely needed, in certain situations. So again, not saying that allopathic medicine is trash. That's not at all what I'm saying. I think it's incredible. Science is incredible. But I do find that as we've kind of come away from traditional true medicine, what Hippocrates intended, and have come over more into the science side of things and really into the allopathic side of things, everything became a quick fix. You have a toothache as a baby, here's baby Tylenol. You have a headache, here's an Advil, stop the pain quickly. You have another issue, take this pill, mask the symptom, feel good. We've really gotten to a point, even things like Amazon, you want this product, push this button, you'll have it in a few hours, or you'll have it tomorrow. You want to get food, click this button and have it delivered to your door in 20 minutes. We've gotten to this point in society where we want quick gratification. Everything needs to be quick. And so when something takes a long time, in the case of holistic medicine, working at the root of the problem, really understanding the different layers of the biology and addressing each layer to fix the true root cause of the symptoms and get it cleared up for good, that takes time. It can take several years depending on how long you've had the condition. I have clients who have had psoriasis since childhood or since their teen years, so more than 10 years, and they need years on protocols to clear it up. They see improvement throughout that time, but they need years to really reverse and finally break through that entrenchment of inflammation, that inflammatory loop that they've been stuck in their whole life, to break that loop and finally start seeing lasting changes. But to get to that point, it is a lot of stamina. It is exhausting. It takes a lot of effort and patience and money. It is not easy. And so a lot of us, I mean, there are some really strong clients that I have, and I'm like, you guys are incredible, because this is not easy. There are some people who just push through and who see those results and finally get to that light at the end of the tunnel, and it all becomes worth it. But to get to that point takes a lot of time, effort, money, patience, trusting in the process, and you're not getting that quick gratification. So you don't get that quick change in your symptoms. Some people do. Some people bounce back really quickly and see those results, but a lot of people who have had conditions for a while, skin conditions for a while, it can take time, and that's what we need, is that patience. So antibiotics, when they tell you, oh, in 2 months everything's cleared up, that sounds pretty good when you've been working on something for a while and haven't yet seen results. So I understand that, and that was me for a long time. I was going from one doctor to the next, looking for that quick result. I was flared up. I remember one time I was covered, excuse me, at the time it was eczema, it wasn't yet psoriasis, but I was covered in rashes, and I had a wedding. I literally walked into my doctor's office and I said, I have a wedding next week. Like literally I said next week. I didn't even give him a month. I was like, I have a wedding next week. I need to have my skin completely cleared for the wedding. What do I need? And he was like, oh, here's antibiotics, and gave me antibiotics for it. Me stupidly thinking that it's even possible to clear the skin in a week. Antibiotics made me flare up much worse. I actually couldn't even attend the wedding, severe IBS. But that's a story for another day. But that's how I used to be. So I understand that wanting the quick results. That was me 100%. But when I finally tried everything and realized that my skin is going to keep coming back, it's going to keep getting worse, it's going to get harder and harder to fix because I'm getting worse and worse and worse. At some point I was like, let's just try the natural side. And boy, was it hard. It was years and thousands and thousands and thousands and thousands of dollars that I didn't have, but years and money and strict diet to get to those results, to get that clearing. But when I started seeing that clearing and it was consistently clearing, I was like, I will spend another $100,000. I will spend another year or two. I will do whatever it takes to get to that point, because I started seeing the results, and I knew, again, I would never want antibiotics unless I absolutely needed them, or I never wanted anything like that. Again, I wanted the natural to get to the root of the problem. And that was worth it to me. And now I've been in remission for 5 years, 6 years. I don't even know how long, maybe even longer. I've been in remission for so long, probably, I think it was 5 years now, 4 or 5 years. Feeling great, still getting to go out and eat food that I love, living life like how I should be without having to use medicine, actual allopathic medication. So that's what I wanted to share today is, should you be on antibiotics? It is up to you. It is truly up to you what you want. If you want the quick results, antibiotics can often offer that. But then just know that there's that massive potential to flare up much worse in the future, plus all the side effects, and knowing that you still didn't get to the root of the problem. So that problem's always there, and it just kind of bubbling at the surface, and at some point can flare up really bad again. Whereas the holistic side of things says no to the antibiotics, unless, again, absolutely needed. Check with your doctor, but works on the root of the problem, takes a lot longer to get the results and a lot more time, money, and patience, but I believe much more worth it, because then it puts you in that remission and gets you to a point where you are excited about your skin. So I hope that this video helped. I hope that it kind of answered some questions. Again, I'm not saying to never do antibiotics or never take them. There are a time and a place, but I think just taking a really strong antibiotic for 2 months to clear acne or to clear eczema or psoriasis or whatever is not the best option. And I recently had a client ask me about my opinion, so I kind of thought I'd just make a video, because the amount of times I get asked this question between Instagram and YouTube and my clients, it's like several times a day. So I thought it'd be easier to just make a video sharing my thoughts and opinions. I hope it helped. I hope you guys have an incredible week and weekend, and I'll talk to you soon. Bye.